Reactive Attachment Disorder, or RAD, was first added to the DSM-3 in 1980 and has since been revised numerous times. Since the diagnosis has been rather controversial, RAD may again be revised. As of now, the diagnosis is seen in children typically 5 years old, but sometimes can be diagnosed as early as a month old. For a child to be diagnosed with reactive attachment disorder, the child should show a number of symptoms. These include, but are not limited to, they are seen as emotionally withdrawn, show unexplained irritability or sadness or fearfulness even in non-threatening situations, control issues, anger problems, and show a lack of need for basic emotional needs such as comfort, touch, or affection from caring adults. Reactive attachment disorder is typically seen in children who have undergone abuse or neglect at the hands of adult caregivers, and the symptoms must persist for more than a year. It is a relatively rare disorder for children and infants to be diagnosed with. Children who live in group homes or foster care, or children from large families, are at a high risk of developing RAD. As of now, there are not too many treatments for RAD. The three most common options include play therapy, holding therapy, and family therapy. Play therapy is when the child is encouraged to act out their feelings through play, which is guided by the therapist along with help from the caregiver or parent. In order for play therapy to work, three specific ingredients are needed. These include security, stability, and sensitivity. In order to reverse the effects of reactive attachment disorder, it is very important that the parent or caregiver and therapist demonstrate that they are capable of listening to what the child has to say and the child feels like they are not being judged. Children who use play therapy as a form of treatment were seen to have had positive and healthy changes in the way they responded to the world. Holding therapy is when the child is exposed to, say, holding, tickling, poking, or tapping until the child stops trying to escape from what they are being exposed to. After this, the child is given back to the caregiver or parent in order to form an attachment to them. Children who were exposed to holding therapy demonstrated a decrease in aggressive and delinquent behaviors. Family therapy is when the whole family participates and expresses their feelings to a psychologist or licensed therapist. Family therapist teaches the parent or caregiver and child how to bond with each other. It is seen that by having the parent or caregivers involved in the therapy, the child is more honest about everything. Though play therapy and holding therapy have been seen to work as treatment for RAD, they are more controversial treatment options. This is because they use techniques that could be seen as dangerous, and holding therapy in particular could cause more damage than good if not used correctly. It is noted that family therapy has the most positive treatment outcome as long as the parent and caregivers are willing to be involved in the therapy. If you or someone you know has a child that you think may have reactive attachment disorder, call 0 to 3, the National Center for Infants, Toddlers, and Families at 202-638-1144 for help.